Competency-Based Education, or CBE, is implemented in many countries worldwide. CBE is student-centered and is focused on mastery of competencies while based on learning outcomes. A competency describes a set of knowledge, skills, and attitudes that students need to acquire throughout their studies. Learning through CBE allows future nurses to develop competencies for use in the clinical field. Some of these competencies are exemplified in the following story of a nurse called Peter. Peter is a graduate nurse from a university in Kenya, and he is looking forward to beginning his career. He started working in a hospital as a nurse. He is excited about this new chapter in his life, but is also nervous since these are his first days. The first patient comes in. He feels dizzy. Peter welcomes him. They have a conversation and the patient expresses his concerns. Peter shows empathy and tries to comfort the patient. He establishes a nice atmosphere. The patient is satisfied and trusts the nurse. This is an example of the competency of communication. It describes the ability of healthcare workers to interact effectively with patients. Peter practiced this skill when he was a student, and now he knows how to communicate with this patient, how to show him empathy and establish a relationship of trust. Later on, a doctor and another nurse join Peter in the consultation room. Peter presents the case to his colleagues. They decide altogether that further examination is needed, and the doctor gives instructions to Peter. This competency is called collaboration, which is the ability to work effectively with colleagues. A good collaborator should be able to follow instructions and respect different opinions within a group. After the doctor's instructions, Peter is explaining the procedure to the patient, and he continues with drawing blood. In this setting, he is using his practical skills. This falls under the competency practical expertise and refers to everything that a healthcare worker might perform at the patient's bedside. This includes hands-on procedures or diagnostics. Later on the same day, a young Muslim woman comes to the clinic. She is pregnant and she is in labor now. Peter offers to assist her, but the woman kindly refuses his help, and she mentions that she would like to be assisted by a woman nurse. Peter respects the patient's wish and calls his colleague right away. Peter has developed a competency named ethics and professionalism. He acts according to well-established ethical principles and respects the patient's culture. He satisfies the patient's wishes and shows professionalism. 3 years later, Peter is now the chief of nurses. He is giving instructions and he divides the tasks among the team members. What Peter is practicing now is his leadership and organizational skills. He has the ability to lead a group and make decisions. He manages the available resources and workforce effectively. But what does Peter do in his free time? He's searching on the computer and he's studying. This competency is called knowledge and development. Peter keeps himself up to date with the new advancements in the field of nursing and expands his knowledge. CBE is a way to develop well-rounded professionals who will have the appropriate knowledge, skills, and attitudes.